So a quarter to half of Swiss population consult complementary and alternative medicine providers. So we felt if we want to do a study that represents the diversity of vaccine motivations and attitudes in Switzerland, we have to include these providers of complementary medicine. So that's what we're doing. And we're actually doing the study together with some complementary medicine providers. We include them on our research team. We include them in our research meetings. We include them as co-authors on our manuscripts to always have their perspective included at all times. It's not been hard at all. I have a reputation of being undogmatic and open to CAM views on medicine, and I know some CAM providers from medical school, and this has been a very fruitful and easy interaction and very productive. I can only recommend it to other researchers in the field.
So for our study, we started with a qualitative approach, and for that it involved going and talking to some of these medical providers. And so we talked to biomedical, your traditional biomedical providers, and we also interviewed complementary and alternative medical providers in Switzerland. As part of the qualitative phase, we also talk to parents, and some of these parents are hesitant towards vaccines. Some of them are not, and they vaccinated according to the schedule. And so with what we learned during these qualitative interviews, we added for the next phase of our research, which is the quantitative phase, we added to the PAC-V survey. It's a 15-item questionnaire, and we added many, many other questions to kind of bring things together and make it more appropriate for the Swiss context, to give us really good data about vaccine hesitancy, immunization, and Switzerland. Another methodology that we used for this study was observations of medical consultations, and for that we observed these consultations during which parents discuss vaccination for their young children. We did this with both biomedical providers and with CAM providers. So we were able to sit in the office, take notes, and we call that ethnographic data. And then we had a more structured approach at the end. We fill out an observation grid to kind of look at things that are important when it comes to vaccine hesitancy or vaccine uptake. And that has to do with time spent discussing vaccinations, kind of the emotions, the presumptive versus participatory approach. And so we had a kind of a more systematic approach after that. But first we really start with really thick description, and this is an anthropological term, thick description of what's actually happening in these practices. So what we're trying to learn from the study is to get a better picture of where we're at with vaccine hesitancy in Switzerland. We do have information about vaccination rates in Switzerland. There's not a ton of work that's been done on vaccine hesitancy as its own topic. And so it's important, I think, to recognize that vaccination rates and immunization rates are not always the same thing as vaccine hesitancy. So some researchers like to use it as a proxy. It can be a proxy, but getting a better picture of vaccine hesitancy in Switzerland.
So in our view, the first step is to understand before we intervene, and that's what we're doing right now. We need to understand the approaches that the CAM practitioners take. And I think the intervention will consist of a communication intervention in the future, training, practicing pediatricians, training, practicing family doctors, or even intervening, as we saw today, at the level of residents in training who will be going out in the field in a couple of years, being autonomous doctors. So this could also be done in medical school already, where vaccination training is rather, modest, limited. And our concept, again, would be to get the CAM providers on board to develop these didactic materials together with us to make them palatable and credible and plausible to not just the biomedically oriented physicians, but also to the more complementary, alternative oriented physicians.